Hello, so basically this video, it's just to basically give you a bit of insight into scar revision on piercings, and a little bit about my story, and hopefully you find it helpful to make your decision or just to get some advice. So I'm going to quickly show you the scar that I've got, and then I'm going to tell you about the consultation I had today. Okay, so the piercing I had was a Medusa piercing, and it basically has left a hole where the piercing was. Very common thing in lip piercings because they only ever close from the inside, especially when you've worn them for a while. Not so much the other side. So. So in order to basically take away that hole on the outside, a excision of the skin is taken out by a plastic surgeon. So I had the piercing when I was 16, and I took it out when I was 25, and now 5 years later, I've kind of thought about it for a long time, and I've realised I want to get rid of that hole. So I had a consultation with a plastic surgeon today. I researched him for a long time before this, so you know, this wasn't just some random guy I found. The surgeon is a 5-star surgeon. He has loads and loads of knowledge of all types of surgery, so that's really important. Be sure if you're going into this type of thing, you research your surgeon or doctor or whoever is going to carry out the procedure. So in the consultation, the first question I had for him was, have you performed scar revision from lip piercings before? And he answered yes, he's done dozens of them. So I know that he knows how to do it. The second question was, do you have any photographs from before and after? The answer to that was no. You know, it would have been nice to see that, but sometimes maybe it's just, you know, people are in and out and they don't get photographs. I'm not too sure about that. So the third question is, you know, what technique will you use to excise the scar? And the answer to that is using a dermal punch, a biopsy punch, which you will see many videos online as to how that's used. So it's like a dermal punch, and the diameter of the punch is 2 mm. So basically, he inserts a punch, super sharp, and that goes right into the kind of into the scar tissue, just around the scar tissue, and what he's got to do is basically pull out the whole tract of the scar. So it's like kind of a little tube they pull out. They don't just pull it out, they like snip it out and stuff. And essentially, once that is excised, they can then start to just work on like the stitching and that type of thing. So a lot of piercings, basically, when they are being revised or, you know, reduced in appearance, they'll use a biopsy punch. They'll also stitch the back, the outside of the lip, as in the inside, yeah, and they'll stitch the front. So with this piercing being a very mobile area, it's not quite like your Monroe piercing or your labret. It is the Medusa piercing is right in the middle of the lip, the philtrum. It's a very mobile area, and that's something to consider because the biopsy punch is something like, say, it's going to be like 2 mils. It's quite a small size, the diameter of it, but they can't just stitch this up after. It's a possibility, but basically, in order to ensure that there's no kind of opening of the wound, of the scar, once it's stitched up, it is advisable to put a stitch internally in the lip. And so what this does is essentially kind of knits everything together, and it creates like a framework for the skin to construct around. So it's, yeah, so that's advisable in this kind of hole in the place it is at. So what I was saying earlier, the 2mm diameter, which sounds like it could be a pretty neat kind of job on the outside, might not end up being that small, because he might have to cut around the hole in order to get the needle and the stitch internally. So it's a little bit more complicated than other piercings on the lip. So just be aware of that if that's what you're looking into. Some people don't want to have a, there's no guarantee it's going to be a bigger scar, but the line, like the length of it will be, the actual kind of appearance of it might not be. So that's the risk you take. For me, I don't like having the hole there, so actually replacing it with a line would be more aesthetically pleasing. Ideally, a smaller line if possible, and it can work where they use a 2mm punch and then they also just get the internal stitch through that hole, and hopefully that is what will happen. But the warning I was given today is that it might not be as small as I expect, because he does advise using that extra bit of stitch on the inside, and that makes sense. So I said I would be happy for him to judge it when he does it, and ideally if he can just get it in the 2mm space and then stitch on the outside, that would be perfect. If not, it might be a slightly longer scar. So it's always going to be in this kind of area, like a vertical line, and like I say, that can range from 4mm to 6mm in length. So yeah, so that's the answer to what type of scar you'll be left with from this type of surgery. So the healing time, that when the stitches go in on the outside, they're then taken out a week later, and this is so you're not left with any inappropriate scarring from the stitches. On the inside, so internally, and then on the outside on the inside, these are dissolvable stitches. So basically they, you'll not notice them, they'll just disappear. And from what I understand, the kind of bit that's keeping everything together inside the lip, that stitch will keep it in place for like 4 weeks. So that gives it time to work its magic when you are moving your mouth, eating, brushing your teeth, doing all of these things that, make the mouth more mobile. So yeah, there we go. So of course the question a lot of people have is, what are the complications from having the surgery? And the answer to that is infection, bleeding, scarring, keloids, and opening of the wound. Obviously those type of things will depend on the person. The opening of the wound will depend if you get that internal stitch or not, so on. When I personally went to find information on my piercing and getting it revised, I couldn't find a whole lot. I did find people who've had lip piercings, and it's a similar process, but it's not quite the same. So that's why I thought this video would be helpful. You can find people who've had this kind of procedure on Instagram, so you can see the before and after pictures, but there's not a whole lot of information about the procedure. And that's something that in the next video I'll be showing you the result of the surgery, and hopefully be able to get some kind of maybe some video footage of what it looks like, and that type of thing. So so okay, so I think on the outside there'll be like kind of like three stitches, and on the inside maybe just one, and then internally probably one. yeah, so that's that. Cost wise for this kind of operation, you're looking at about £800. You might find somebody cheaper, but the guy that I'm going to is very well accredited and does have a 5-star reputation, so I just feel comfortable going to this person. Okay, anything else? I know there are other techniques out there. I would say just be careful what you choose to do. There is a process called TCA cross. I have seen this, well, I have heard that it can be effective, but there's not a whole lot of stuff out there to see, so for me that was kind of like too risky. And when asking the surgeon about it today, he said it's the outcome is too uncontrolled. There's not, you can't kind of say what result you're going to get from it. It would be trial and error, and I'm not really that comfortable with inputting a chemical acid in my skin to hope it's going to burn off my skin and then bind it back together if it might not. Whereas this technique has been used many times and people get a decent result from it. So that's why I've chosen this technique. I'm not here to make your decision or your mind up. So that is totally up to you. If you want to try something else, always go through a professional. Yeah, so just like I say, do your research when it comes to the surgeon or whoever you go see, and make sure they're fully accredited and have done the procedure before. I think that's it. Next time I do the video, I will have had, well, I'll have photographs of the procedure, or at least photographs of the post operation. So I'll be posting some photographs before, post operation, and then the healing process, so we can see what it's like, and hopefully that is helpful. Okay, see you soon now.